morning. Let's bring in practicing internist, healthcare educator, and mental health advocate, Dr. Lucy McBride. Dr. McBride, I want to read from the piece you co-wrote for the Washington Post, in which you write this. Here's one simple recommendation. Children should return to their normal lives this summer and in the upcoming school year without masks and regardless of their vaccination status. Overall, the risk to children is too low to justify the remaining restrictions they face. Schools should lift mask requirements for children, especially outdoors. They should also do away with plexiglass barriers, face shields, and deep cleaning, which were never supported by science. Instead, schools should rely on staff vaccination to protect adults and children. Even small steps toward normality can have a large impact on a child. The simple gesture of allowing a child to take off their mask might give them more sense of control and allow them to see that reassuring smile from a friend. So, Dr. McBride, this is something a lot of parents have been hoping to hear from someone like you, that it is safe to fully return to normal for most children. So can you just underline some of the data that brought you to this conclusion and how unlikely it is for a child to contract COVID? Not impossible, of course. There have been a lot of serious cases, but how unlikely it is.
Sure, Willie, and thanks again for having me back on the show. So in my piece, co-written with super amazing physician scientists Tracy Hogue, Monica Gandhi, and Alison Krug, we talk about the facts that the chance of a child being hospitalized from COVID-19 is somewhere between 0.1 and 1.9%. You also then take the fact that even over the past 4 weeks in the United States, as more shots have gone into American arms, the incidence of COVID-19 in kids has gone down 50%. So one of the ways we protect children is by vaccinating wide swaths of the population. Kids are indirectly protected as adults are vaccinated and therefore do not likely transmit the virus to others. Next, we see the emotional toll of kids restricted from their normal lives. Suicide rates are going up. In Colorado just this week, we saw a pediatric state of emergency declared because of the number of suicides in that state. And so, in other words, when the risk of COVID-19 to children is relatively low and the benefits of them resuming normal life are enormous, then it's time to really shift the public narrative and shift our policies towards ones that are based in fact and not fear.
Yeah, the mental health piece of this is so important. I can't tell you how many times in the course of casual conversation over the last year, a friend of ours or someone we know has said, yeah, so-and-so, our child is seeing someone. You know, they're talking to a therapist. It's been a very, very difficult time for kids across the spectrum in this country. So are you seeing schools responding appropriately here? I think, you know, a lot of these municipalities, Los Angeles, New York City, have said schools are open in the fall. We're coming back. Do you see that across the country?
Well, I think the schools are largely waiting for the CDC to issue more nuanced guidance. I mean, the first thing the CDC needs to do is lift mask restrictions on children and everyone, vaccinated or unvaccinated, outdoors. It doesn't make any sense for anyone to be masked outside. Of course, if you want to, you can. If you're at high risk or you just are more comfortable in a mask, wear a mask outdoors. But there's no reason for a mask mandate. It's simply not rooted in science. And then the CDC needs to amend their camp guidelines even further to allow vaccinated, counselors and campers to have more freedoms. And then CDC needs to go further and say what we have said in our opinion piece, which is that we can expect in the fall case rates to be so much lower than they are now. We have the luxurious ability in this country to vaccinate more and more people with each passing day. And there's just no scientific reason to have plexiglass barriers, deep cleanings, and to mask children, vaccinated or unvaccinated, when case rates are so low. Kids need school like fish need water. It is an important, essential part of their social and emotional health. We need to put kids first, Willie. We need to prioritize their needs. There is no child-student union, right? There is no voice for these kiddos. They are suffering silently behind closed doors. We can measure suicides. We can measure hospitalizations for mental health distress and despair. We cannot measure as readily kids' depression, anxiety, loneliness, isolation. Frankly, as you know, kids are not safe in many cases in their homes. Kids are not being fed without school. This is a national emergency, and we need to invest in kids' mental health, just like we've invested in the American Rescue Plan with gusto.
Amen to that. And there are millions of kids who completely lost touch with their school, which is the one touchstone, the one safe place that they've had. So, Dr. McBride, I think there are a lot of parents and kids, middle school age and high school, who now that the vaccine is available for 12 and up say, I'm good, I'm ready, let's send them back to school. I think even for parents who agree with you on almost everything you've been saying so far this morning, they say, for elementary school, I'm still a little worried my kid's not vaccinated, to throw them all back in the classroom again and to take away all these mitigation efforts. What do you say to those parents?
Sure. And I say to those parents, who, by the way, are my patients, I understand your fear. I understand your anxiety. You know, I have patients who are immune suppressed, who don't have the most robust response to the vaccine, who are higher risk, whose unvaccinated kids may pose a higher risk to them. And I'd say to them, I hear you. I understand your anxiety, but it doesn't make sense for the entire population in the United States of kids to mask when people can have the option of masking if they want to, if they are at high risk or live with a high-risk adult. Most kids, and in general, kids are largely spared from the severe consequences of COVID-19. And, you know, most kids, you know, some kids are pandemic-proof, but most kids have suffered enormous and yet to be fully quantified losses in the pandemic. So I say to those adults and parents, look, I hear you. But remember that your child is protected indirectly by vaccinated teachers. The teacher being vaccinated protects kids from getting COVID-19 because they're less likely to transmit. Moreover, by August, when school starts, case rates will be so much lower, and the risk to children is, in general, tiny already. So let's think about school as a place to restore their mental and physical health, and a place to go to with hope, and to anticipate hope for the fall.
Dr. McBride, Mike Barnicle's got a question for you. Mike?
Great.
Hey, doctor, I have a question about kids and socialization who haven't really learned to socialize yet. I'm talking about children who are in pre-K, kindergarten, first grade, sometimes daycare, and the lack of socialization on them in this formative aspect of their lives. Talk about that.
Sure. You know, kids need the full range of facial expressions and to interact with their peers truly for their brain development and their social emotional health. This is not a small point and a really, really excellent question you're asking. It is really doing so much harm to these kids. Now, parents may think, oh, my child doesn't mind wearing a mask, you know, he or she is not bothered, and that may be true in the moment. But we need to look at the faces beyond the masks. We need to understand that developmentally, kids need to have peer-to-peer interactions and human connection to really develop. So I'm with you that we need to really, really realize the difficult to measure, yet no less important metrics here on kids' brain and emotional development.
Dr. McBride, it's Casey Hunt. There are 2 new studies out that suggest that people who had mild infections of COVID and then got vaccinated had antibodies nearly a year after being exposed. And the lead author of one of the studies says that certain memory cells are so strong against the virus that they even fight off variants as antibodies continue to evolve. This might suggest that if you've had COVID and then gotten the shot, you may not need a booster. What do you make of these studies, and what does it say about the adults that are going to be in the schools with our kids and what they're going to need to do to keep them safe?
Yeah, thank you for that question. I loved this reporting in the New York Times yesterday from Apoorva. It was a very, very nice summary of the vast and wide capacity of our immune system. People think incorrectly that antibodies are the only way we are protected from COVID-19 or from infection. In fact, B cells, which make antibodies, are only one arm of the immune system. We have T cells that are robust and that respond in incredible ways to the COVID-19 vaccines. We also have the ability to make memory B cells that retreat in our bodies and that are ready later in life, should we need them, to make fresh batches of antibodies to fight the threat of COVID-19 if we're exposed to it again. So this study in Nature that came out on Monday, and this reporting is wonderful because it reminds us to trust our immune systems, that the immediate threat right now is not variants or the need for boosters. That is not an immediate threat. That's not something I think about every day with my patients. I think about the immediate threat right now being not having our public policies and our internal narratives rooted in science. We need to resume normalcy. We need to practice, taking small steps to reclaim our lives and to mitigate risk, because of course people are still at risk for COVID. It's just more nuanced.
Dr. Lucy McBride makes a convincing argument in her piece in the Washington Post. You can go online and check it out. Dr. McBride, always great to talk to you. Thanks for being here this morning. Still ahead on Morning Joe, with U.S. troops headed for the exit, Afghan forces are surrendering